Good evening, everyone, and welcome to OET Speaking Speculation. This is me, 𝐎𝐞𝐲 𝐒𝐤𝐞𝐚𝐤𝐢𝐧, joining you from 𝐎𝐿𝐻 Academy. Yes, we've come with yet another OET Speaking Live, where we'll be showing you a role play card, and then we'll be showing that role play card for 3 minutes, and after that we'll be discussing the card in detail. So before that, I'd love to know how everything's going with you guys. Are you all doing good? Is everything going well? Are you all practicing really well? And how is your practice going? And let me know about all these things in the comments. Are you all practicing your speaking every day? That is important. You have to practice your speaking speaking every day, and that's important because, like I tell you always, if you miss a single day's practice, that affects your fluency. So you will see a change in your fluency, the way things are going, flowing from your mouth. So, and you need to have this mental fluency and physical fluency. So if you need to have it, you have to practice almost every day till you reach your exam. And I think I've mentioned this in the previous live as well, that till the exam day, try to focus on English contents. So try to improve and increase your exposure to English. So watch more English content, listen to more of English content, and when you're listening to English content, make sure you're doing this active listening. You're actively listening to every part of it, so that there is a difference between simply listening to something and doing this active listening. So when you're just listening to something, what would happen is when you just you're listening to something, so you understand what they're trying to tell you, what they're trying to convey, and all of those things, but you wouldn't know or you wouldn't understand the language aspects of it or the linguistic aspects of it. So for that, you need to have active listening, where you would listen to each and every sound in it and each and every word in it and how it is pronounced, and you will try to make those sounds, you will pronounce those things that way, and you will be able to have better fluency, and things and words would actually flow. So I hope you'll be careful about those things, and you'll do your active listening, because listening and speaking go hand in hand. Only if you have good listening, like good listening skills, would you be able to speak really well, because you speak what you hear, right? You speak what you listen to. So when you listen, you're storing information there, and then when you speak, you're taking it out. And always, it's like if you have, imagine you have 70% of information in your head, but you'll be able to take out just 50% of it. Not the 20% wouldn't come out, it would still be in your head. So always try to improve and improve and improve. So you should work towards that. And that's how you improve your fluency. And we've told you that another way to improve your fluency is to just speak to yourself if you don't have anyone to practice with. So you're listening to things and then you're speaking out what you heard. Your mind would automatically store all the things that you learned while you were listening or while you were doing your active listening. So you will have those things in your brain. Then you have to practice with it. Then you have to make use of it. Then you have to speak, and then these words or these pronunciations would actually flow. And you have to take conscious efforts. If it is about improving words, your vocabulary, if it is about using good words and new words in your speaking, then for which again you have to put conscious effort. You have to learn a word, like you have to watch contents related to your OET speaking, and then you have to find new words and you have to note them down and learn it and keep the list of words nearby while you're doing a card, and then try to use these words consciously. So you might be using some other word, but then try and force yourself to use the other word that you've learned if you want to include words like that. So these are the things that you have to do, and try as many cards as possible. But when you try, make sure you're following the rules that have to be followed, like how to do it, which all criteria have to be fulfilled, what do I have to do here, and how do I form a sentence here, how do I frame a question here. Those things have to be, that the proper method has to be followed. I mean, there are different ways in which you can do it, but there are certain things that you should be careful about. For example, the grammar, the types of sentences that you can ask, the types of questions that you can ask in between, like, is it clear, am I making myself clear to you? Do you have any concerns? Those kind of things. Okay, so you should be careful about all the assessment criteria as well. Yes, Dar Mohsin, good evening. Going good, but a lot of humming. Okay, so Sophia Jithin, hi. Yes, so happy to see you both here. So I'm so happy to know that you're going good, but except for a lot of humming. Okay, so I'm Sophia Jithin. I know you from the previous live. I hope you're also doing good. So you know the usual drill. So it's sometimes we do a role play, but now what we're doing is I'll show the role play card. On the screen, you'll be able to see the role play card, and you, for the exam, you get 3 minutes to prepare. And here also, I'll be giving you 3 minutes to prepare. So you, when you see it, you have to frame sentences with it. You have to frame sentences, you have to make questions, you have to do the tasks. You should have an idea about how you do. So try to plan the card. Try to plan how you would execute this card first, and then I'll be giving you 3 minutes, and after that we'll discuss. So at that time, you can type in the answers in the comments, and I will be going through your answers and correcting it for you. And I'll also be explaining different ways of saying this answer, because there can be any number of ways in which you can say a task, because different people will have different words and different way of executing it and things like that. So there are different ways in which you can answer this question, but we'll be discussing a few ways in which you can answer this question, or the easy ways to be precise. I'll mention the easy ways and also the difficult ways, and all those ways will be mentioned here, and you can try it on your own using the words that you already know and with the words that are given in the question, and by using synonyms and things like that. So since we've explained the assessment criteria, the things that you have to be careful about, I don't think I have to repeat all of these things in every live. So I'll just move on to the card, the role play card. The role play card will be displayed on the screen for 3 minutes. So did you go through the card? Did you go through the role play card? Did you go through the tasks, and could you plan like how you would say or how you would do each task? Could you plan about how you would do each and every task? Have you made a plan? Yes, using the tips we've shared before. Okay, so a few other people have told me hi. Hi Lijo, TJ, and hi Minto Moni. Nice to see you all here. So now we'll go on to the discussion of this card. So what is this discussion? What is this card? Basically, the setting is in the emergency department, and you see a 25-year-old patient who's come there with a very bad headache, possible migraine, and he's tried over-the-counter medications and none of them was effective. Okay, over-the-counter medications were ineffective. This is the scenario. And here, now comment, tell me, is it a known case or an unknown case? That's very easy to spot, right? Because the hospital does not have, they're not saying the hospital has the records of the patient. So this is an unknown case. The patient doesn't know you and you don't know the patient. So, do you have to introduce yourself to the patient? Yes, you have to introduce yourself to the patient. And then do you have to ask the name of the patient? Yes, because you don't know the name of the patient. So these things are not mentioned at the task, but when you read, this is not given as a task, but you have to do it. So when you read the question, when you read the setting, you have to understand that you have to introduce yourself to the patient and you have to ask the name of the patient before you move on to the tasks. Okay, so yes, very good, very good. Monica Vegas, good evening. Monica Vegas is saying this is an unknown case. Santhya Naik, unknown case. We have to introduce Monica Vegas. Very good. We have to introduce. So when you're looking at the question, there is this tendency, or it shouldn't happen to you, like that's not given in the task, so that is not a task, so you shouldn't be forgetting it. When you read a question, the first question you should ask yourself is it an unknown case or an unknown case? This is an unknown case, so you have to introduce yourself to the patient. So we'll do that. First, we'll be doing that. So look at our first task. Yes, Gomati Lakshmi. Good evening. So look at the first task. We'll look at the first task. Find out patient's visit. Ask how long patient has been suffering from the headache and if they suffer from headaches regularly. So before we move on to the task, what do we have to do? We have to introduce ourselves, right? That is the first thing we have to do. So you're the nurse, you're greeting them and introducing yourself. Good afternoon or good evening. I'm Hannah, one of the registered nurses working here. Or my name is Hannah, I'm one of the registered nurses working here. Yes, Lima Thomas, good evening. So anything like that can be said. So always remember, if it is an unknown case, the first thing that you have to do is introduce yourself. Though the task tells you to do so many other things, you will do those things, but only after introducing yourself to the patient. And then here they've not mentioned like he's visited the hospital before or he was an inpatient or anything like that. That means even the hospital does not have the records of the patient. So you will ask the name as well. So you don't know the name of this patient. So, and especially it isn't. Okay, Monica Vegas is saying, good evening, my name is Monica Vegas, one of the registered nurses working in the emergency department. How may I help you? Very good, beautiful. Beautiful statement. Okay, so you're saying, how may I help you? So here I've put the question. If you look at the screen, you can see, good afternoon, my name is Hannah, I'm one of the registered nurses working here. How can I assist you today? That's one way. How may I help you today? Or you can ask, what brings you here today? May I know what brings you here today? Another. Can you guys make another statement? Monica Vegas, very good. Good attempt. So here, first task is, so we introduced ourselves. That is not in our task, but we do it because this is an unknown case and it is important that we do it. Next, the task is So we just have 4 tasks in this role play card. But what you can see is each task is actually having 3-4 sentences. So there are 4 things or 5 things for you to do in each task. So it's more like it's a long task. I mean, it's a long card actually, but when you see, you just have 4 tasks, but you have a lot to do here. First thing that they're asking you to do is find out. There you'll be asking a question. Find out reason for patient's visit. So reason for patient's visit, how will you ask? So you can learn some sentences for it, some questions for it, like how may I help you, like Monica Vegas' answer, how may I help you? How can I assist you today? Okay. May I know what brings you here today? So another one that you can say is, or you can say, may I know another one is, may I know what brings you here today? Okay, that's another one that you can ask. So the patient will give you a reply. Okay, so you should listen for what the patient has to say. May I know what brings you here today? Monica Vegas is saying, could you please tell me your full name and age for the record? Monica Vegas, very good. Okay, could you please tell me, you're answering the next part. I'll come to that and we'll go through it. May I know what, you don't need to have a the there. May I know what brings you here today? I think that's a typo. So may I know what brings you here today? Could you please tell me your reason for your visit? Yes. So could you please tell me your reason for your visit or reason for the visit? Very good, very good. That's another way in which you can ask this question. So you've got multiple ways of asking this question. So I would say just learn 1 or 2. Okay, and then stick to that for these 2 and stick to one of those when you're doing these type of questions. So every time you get a question, because for exam, I always have this feeling that for exam, you're just going to use one type. Okay, why do you have to learn so many and confuse yourself? So take the best out of them and for these kind of situations and use it. How may I help you? Could you please tell me what brings you here today? May I know what brings you here today? Could you please tell me the reason of your visit, reason for the visit, or something like that? Okay, so then the patient will give you a reply. Hi, Joyce 𝐒𝐩𝐿, good evening. Patient will tell you, hi, I've been having this terrible headache for the past 2 days and it's not getting any better. Okay, so you listened to the answer of the patient. So when you start, you have another task to do. Ask how long the patient has been suffering from the headache and if they suffer from the headaches regularly, right? So there are 2 things you have to ask. Ask how long the patient has been suffering from the headache. That is 1. And if they suffer from headaches regularly. There are 2 things that you have to ask. So you can break it and ask. So since the patient told you he was having a terrible headache for the past 2 days, so it's not getting any better. So you have to give some empathy statements. So when they tell you something they're going through or when they express how bad it is for them or something like this, you have to give an empathy statement. That's important for your relationship building and also patient's perspective. Yeah, okay, understanding patient's perspective, understanding and incorporating patient's perspective. So it is important for these 2 criteria. So I've been having this terrible headache. So he said that. So what will you say? Obviously you'll start with something like, I'm sorry to hear that. All right. Oh, I'm so sorry to hear that. Or I'm sorry to hear that. Don't worry. Let's see what we can do to help you. Okay. Or you can say some other statements like, we'll try our best to help you with this. Or we'll try our best to see what we can do to help you. So don't worry, we'll take care of you. Okay, something like that can be said. So I'm sorry, and don't worry, we'll try our best to do something about this. All right, don't worry, we'll do something to help you. Oh, don't worry, we'll see what we can do to help you. Something like that can be said. Oh, I'm really sorry to hear that you're having a terrible headache, but don't worry, we're here to help you and you're in the right place. Very good, Monica Vegas, very good statement. Joyce Joseph is saying, oh, I'm sorry to hear that. Don't worry, we're here to help you. Very good. That is also good. A simple way of saying, oh, I'm so sorry to hear that. We're here to help you. And again, you have to be very careful about your tone. You have to sound like you're having some empathy towards them. Oh, I'm so sorry to hear that. We'll take care of you. We'll do our best to help you with this. What are the other things? Don't worry, we're here to help you. Don't worry, we're here to help you, and you're at the right place. Very good. Okay, you're at the right place is also fine. You're in the right place is also fine. Okay, next is, so that's what they've done. And with that, you can ask the patient the name and age. Okay, so before moving on to ask how long the patient has been suffering from the headache and all to the details, first you definitely have to know why they came there. So when a patient comes and one of the registered nurses is here, what brings you here? You ask that question, and then the patient said, this is the problem. So we gave an empathy statement. Along with it, we can ask the statement. So Monica Vegas had actually given me a statement. Could you please tell me your full name and age for the record? Very good. Or could you please tell me your age and record for the documentation? Okay? Okay. So, or could you tell me what your name is and also your age? You can ask like that. But a better way would be, could you please tell me your age and name? Okay? For the record or for documentation. Or you can put documentation first and be like, for documentation, could you tell me your name and age? Here, that is what. Before we proceed, here they're adding a word. Here we're adding a word. Before we proceed, if you want, that's optional. It's not compulsory, you have to add phrases. But if you have, it's well and good. Before we proceed, can you tell me your name and age? Patient. So then the patient will tell you the name. I'm Malcolm and I'm 25. Okay, so nurse is saying, when you hear that, so the patient has told you the name and the age. Okay, thank you for sharing that, or something like that can be said, or you can simply say okay or all right. Some words like that. Again, it's part of relationship build. I mean, you're understanding the patient's perspective. It is very important. So you can say something like that. For my better confirmation, could you please tell me your name and age? For my better confirmation, it can be avoided. Here, this is basically the documentation, right? So she's doing it for the documentation. So you can say something like, or even if you don't mention the purpose, it's understood this is for documentation and things like that. So but if you don't mention the purpose, it is well and good. You can just simply ask the name. Could you tell me your name and your age? That is fine. So avoid such usages. Okay, could you please tell me your name and age? Joyce, for better communication, could you please tell me your name and age? For communication, it's also fine. But I would say you can stick to things like record, documentation, and words like that instead of confirmation, communication, because it is not about like communication. It is not for communication. We're actually asking them for the record, or for documentation, not for communication. So you can avoid that. You can go for stay with something like that. Okay. And then, so when the nurse tells you that, when the patient tells you the name and age, you can say something like, all right, or okay, something like that. Then you have to ask the next question. Ask how long the patient has been suffering from the headache. Okay, so you can call the name, or you can say, when you have something like this, what will you do? Action word is ask. That is the action you have to do. So what will you do? You can ask something like, could you? Okay, so here we use the word how can I? Okay, or may I? May I know the reason for your visit? So here we can use could you? Could you? Could you? Please explain me more about your headache. Yes, that's good. That's well and good, Monica. Okay, Mr. Malcolm, could you please explain me more about your headache? That's very good. So how long, but you should also, the question, they're asking us to be specific, right? Like, how long have you been suffering? So you can add something like this, like, how long have you been experiencing it? So you can ask it. You can either ask it as two questions, or you can ask it as one single question. But I would say it would be better if you can ask it as two questions. So in Monica's statement, what you can do is, Monica, okay, Mr. Malcolm, could you please explain me more about your headache, like how often you get it? So they would say how often they get it. Okay, that should also be added. That specific detail should also be added. So could you tell me more about your headaches? All right, could you please explain your headache, like onset, duration, etc. Onset and duration, that is fine, but I think it would be better if you ask something like, how long have you been experiencing? Like, could you tell me the duration, or how long you've had it? Something like that would be much better. And onset, okay, if you want you can ask, but it's not compulsory that you have to ask it. So could you tell me more about your headaches? How long have you been experiencing this headache? Patient, about 2-3 days. Then you can ask the next question. Have you, if they suffer headaches regularly, do you have, so you can, if the easiest way to make a question with this is, do you suffer? For suffer, you can use experience. So do you add a do. For they, you're writing you. Do you experience them regularly? Okay, or do you have your headaches regularly? Something like that. Is this the first time, or have you experienced this before? This is also another way of asking. And the patient might tell you, I've had headaches before, but nothing like this. I understand. I need to ask you some more questions regarding your symptoms, may I? Now you're moving on to the next task. So if you look at next task, you can see, are you able to see it on the screen? Okay. Find out more about the patient's symptoms. So next you're going to ask about the type, location of pain, sensitivity to light and sound. So 1, 2, 3, 4, 5, 6. You have to ask 6 things. So that means you need to have 6 questions at least, or at least 5 questions. If you're clubbing 2 things, then you can make at least 5 questions. Check what medications patient has taken. Then the next is check what medications the patient has taken, how much, how often. Again, 7, 8. Okay. So you're asking the patient for permission. You're asking, I understand. Okay, the patient told you that he hasn't had a headache like this before. So you're saying, I understand. I need to ask you some more questions about symptoms. May I? So you're asking the permission. Again, understanding the perspective, patient's perspective. Before proceeding, okay, I have an answer here. Before proceeding further, yes, that's a good usage. Before proceeding further, I would like to ask a few questions regarding your present condition. Then I'll explain you in details regarding the management. In case if you have any questions, you can ask. Shall I proceed? Very good. Very good. Okay, so this is beautiful. So before proceeding further, I would like to ask you a few questions regarding the present condition. Then I'll explain in detail regarding the management. In case if you have any questions, you can ask. Shall I proceed? That is the question. So, that is the answer. That is very good. So let's see how we can do this easily. So find out more about the patient's symptoms. Okay? I need to ask you more questions about your symptoms. Is that okay with you, or may I? Okay, so here Monica has used, I would like to ask you questions regarding your present condition. Or you can say your symptoms, regarding your symptoms. Then I'll explain in details. That part is not there, that is also fine. In case if you have any questions, you can ask me. Shall I proceed? Yes. That is beautiful. So here you can say, the example that I'm giving you is, I need to ask you some more questions regarding your symptoms. May I? Or you can say, is that okay with you? I need to ask you some more questions regarding your symptoms. Shall I proceed? That is also fine. Okay? So then, patient is saying, sure. Now, you'll ask the first question, type. How will you ask this question? You can, if you want to make a question with it, simply you can say, what type of pain are you experiencing? Or what kind of pain do you experience? Is it a throbbing pain? Is it just a pressure? You can add some examples like that as well. Try it. Can you describe the pain? Or could you tell me more about your pain? Or what kind of pain are you experiencing? For type, you can use the word kind. Is it a throbbing or more like a pressure sensation? It's more of, so the patient will give you an answer. It's more of a throbbing pain. Nurse. All right, so you're asking this different questions. What kind of pain you're experiencing? What kind of pain are you experiencing would be better. Okay, you can put that R here. And what kind of pain are you experiencing? Or what you're experiencing is also fine. Okay. So, it's more of a throbbing pain. And now when you hear that, you can say, all right, where exactly is the pain? Or where do you have this pain? Where exactly is this pain? Because the patient has come with headache. So you know it is in the headache. Where exactly is it in the head? Or where exactly, so you can use this point, a word exactly, so that the patient will be able to spot it. There would be much more clarity if you're using the word. Okay, where exactly do you experience this pain? Or where exactly do you have this pain? Or where exactly is this pain? Sides of my forehead. So you'll say, okay, and do you notice, or do you have can also be used. Sensitivity to light or sound. Here what you can do is, if you want, you can club two other points as well. Okay, do you have sensitivity to light or sound, and are you nauseous? Okay, yes, we are adding so many other points as well. Any nausea or visual disturbances, so we're adding. You can do this, because if you keep asking one question, so 8 questions here, 10 seconds, so it would at least take 1 minute, right? If imagine 10 questions, 10 seconds is for one question. So 80 seconds it will take. It will take more than 1 minute. 1 minute, 20 seconds it will take. So you can club the questions. Okay? You can ask any nausea or visual disturbances. They've clubbed it. Or you can say, do you feel nauseous or have any visual disturbance? What can you ask? Do you feel nauseous or have any visual disturbances? Okay? Next. So when that is asked, the patient will give you an answer. Yes, I'm sensitive to light and sound. I've been feeling nauseous too. Visual disturbances, yes, sometimes. Next, check what medications. The action word is check. Check what medications patient has taken. Okay? How much and how often, etc. So you can start by asking something like, have you taken any medicines for this? Okay? Oh, okay, we're not done with it. We have numbness, tingling in legs as well. Okay, we have one more question to make. Do you have any numbness or tingling in your arms or legs? So you can simply ask, do you have? Okay? Or you can frame a sentence like this. Any numbness or tingling in your arms or legs? Nothing of that sort. So next, what do you have? The last part, I've highlighted that part. Check what medications patient has taken, how much and how often. Nurse, okay, thank you for sharing that. Have you taken any medication for the headache? If so, how often? Do you have any triggering factors like nausea, sensitivity to light or sound, numbness, tingling in your arms and legs? Very good. That's a good way of asking. I told you, you can club the points together. So here, you just put do you have, and then do you have any triggering factors, or do you experience, or do you have anything like, you can put them together and write. So here Monica, what she has done is, do you have any triggering factors like nausea, sensitivity to light or sound, numbness, tingling in your arms or legs? So this is fine, but I would suggest you clubbing 2 things or 3 things, not all of them. Because if you club all of them, then you are not giving the patient to the opportunity to actually answer them, because they'll forget all these points. So it's better that you ask 2 questions together. Okay, I think that would be better rather than putting all these points together and asking a question. Okay, so be careful about that. Check medications patient has taken. So have you taken any medications for this, or have you taken any medicines for this? If so, how much and how often? Just asking these 2 questions together. You don't have to go for a separate question, just do it together. All right, okay, thank you for sharing that. Have you taken any medicines for this? If so, how much and how often? Then the patient will give you a reply. I've tried taking ibuprofen, but it hasn't made much of a difference. I took the recommended dose a few times over the past 2 days. Okay? Next, third task. Look at the third task. Ask whether patient has seen a doctor before regarding this. Explain the risks. So this is one task. Explain the risks involved in self-diagnosis or self-treatment. Example, unnecessary stress, condition possibly. Thank you for the information. Very good. Nice, beautiful usage. Additionally, I would like to know that, have you taken, I would like to know if you've taken, I would like to know that, no, I would like to know if you have taken any medication for this. I'd like to know if you've taken, I would like to know that you've taken, have you taken? So that doesn't form a good sentence. What you can say is, I'd like to know if you've taken any medications for this. If so, how much or how often? You can add that point as well. Okay, so for the third task, explain the risks involved in self-diagnosis, self-treatment. Example, unnecessary stress, condition possibly not as severe as the online results portray. Taking the wrong medication can lead to another illness, okay, etc. So here, how will you answer this question? How will you do this task? Ask. The first action word is ask. Ask whether the patient has seen a doctor regarding this. So you're asking about something happened in the past, but any time during the past. Okay, so how will you start this question? There is just only one way to start this question, which is have you. Will it be correct if you ask did you? No. Why? Because here you're asking the patient if he or she has seen the doctor anytime during which he or she had headache. So not one particular time in the past, right? So when such a question is asked, or when you have to ask a question in such a context, you'll say, have you? Okay? Or have you ever? Have you ever seen a doctor about your headaches before? So something in that box. Thank you for the information. Okay, I read that, right? I would like to know that, have you taken Okay, I read that. Have you ever seen a doctor? Ask the patient has seen a doctor. So you can take the hint from the task itself. In the task, if they've used has seen, start the question with have. That's how you can avoid the mistake. Okay, have you, you can ask have you, I'll show you. So here you have has seen, right? So what you can do is, you're asking the patient, right? So you're asking, have you seen, just making this have, has to have because of you, not patient. You're making it to you. Have you seen a doctor before regarding this? You're making it into headache. Clear? So simple. Have you seen a doctor before regarding this headache? Simple. You're just changing, making small changes, and you're making a sentence. Beautiful sentence. Next, explain the risks involved in self-diagnosis and self-treatment. Example, unnecessary stress and all of those things. So we'll see. Have you ever seen a doctor about your headaches? No, this is the first time it's been this bad. Okay, I understand. You can say something like, I understand. But it's important that you consult a doctor. Okay, it's essential to address these symptoms with a healthcare professional. Okay, you're adding a statement like this. It's essential to address the symptoms with a healthcare professional. So, or you can say, okay, I understand that, or okay, but it's important that you consult a doctor when you have symptoms like these. You can add something like that. Because, and then you can say because self-diagnosis and self-treatment can lead to unnecessary stress, as the condition possibly may not be, possibly wouldn't be as severe as the online results portray it. So, and also taking wrong medication can lead to other illnesses, or can cause another illness. You can add something like that. So you can say, what can you say? It's important that you consult a doctor when you have some symptoms like these, because self-treatment and self-diagnosis can cause unnecessary stress, because as the condition may not be as severe as shown online, and also taking wrong medication can lead to other illnesses. Is it clear? Just use saying self-treatment. It is important that you consult a doctor when you have symptoms like these, because, or if you don't have a statement like that, it's fine. You can simply say self-diagnosis and self-treatment are very risky because they have unnecessary stress. They cause unnecessary stress, telling you the condition is more severe, but in reality the condition may not be as severe as it is portrayed online, and also taking wrong medication can lead to other illnesses. So just make a sentence like that. Okay, we'll move on to the next task. Emphasize importance of getting a confirmed diagnosis from doctor. Say you cannot prescribe any medications, only the doctor can. Confirm patient will wait to see the doctor. So many things to do here as well. So you can say this part. Emphasize the importance of getting a confirmed diagnosis from doctor. So earlier, if you said it's essential, here you can say it's important to get a confirmed diagnosis from doctor. It's always best. Okay, for important, you can use the word it's always best. This is another way of saying it's always best to seek a confirmed. Seek, for getting, you're using seek. Always best, importance. Okay, it's always best to seek a confirmed diagnosis from a doctor. I hope you understand. That is important to just make sure the patient understands what you're saying. So patient is saying, I understand, I'll wait to see the doctor then. you have the next task, which is, the next part of your task. Say you cannot prescribe any medication. So when you are denying something, or when you are saying something negative, how will you express that? You would sugarcoat it. You would say something like, I'm sorry, or I'm afraid, I cannot prescribe any medications, only the doctor can prescribe them. You can say something like that. Or you can appreciate what the patient has just said. You can respond to what the patient has said and then move on to the task. That's a wise decision. Remember, I cannot prescribe any medication for you. Okay, so you can tell her like, I'm afraid that I cannot prescribe medications for you. Only the doctor can prescribe them. So you can wait here, and I'll make sure you'll see the doctor as early as possible or as soon as possible, and thank you for your patience. So here you can see only the doctor can provide proper diagnosis and treatment plan. I'll make sure you're seen as possible, as soon as possible. Thank you for your patience. Patient, thank you for your help. So this is what it is. Do you guys have any questions related to any of these tasks? Like how you do it or something? Yes. We had a few responding, and I was so happy to see that, answering the questions actually and giving beautiful answer, especially Monica Vegas and Joyce 𝐒𝐩𝐿, who else? Santhya Nayak, and yes, you guys were just answering. And who else was answering? Gomati Lakshmi, no. Yes, so these many students were actually answering beautifully, and you were giving me beautiful answers. I really appreciate it. So these are the 4 tasks. These tasks were actually simple, but the thing is, each task has got multiple things to do in it. So you need to be careful about how you do it. And when you ask questions, you know how to frame. If you actually know how to frame a question, then things are actually easy for you. It was more about asking questions, and you don't have anything like reassuring the patient or explaining a procedure. Nothing was there. It was mostly about asking questions. So in this question, it was important that you knew different types of different ways of asking questions, and different types of question words, like the words that you can use to start a question. So that if you know that would be very helpful. So and then these are the things, like I said, you can do simple things like putting a have you, take hint from the question when you have to ask questions, and then make questions like that. Then club questions. So if you're making 2 things together. Very good, Monica. I'm afraid I'm not the authorized person to prescribe the medication. Okay. And you deserve it, Monica. Monica is saying thanks for the appreciation that I gave her. But it was like the answers were really beautiful. Keep working towards your dreams, all of you, so that I'm sure you will reach it. Okay. If you're wishing for something so badly, it will happen for us. The universe will conspire, and it will definitely happen. So I hope this live was helpful to all of you, and you were able to get some idea about how to answer your tasks, and how to do the questions, and how to frame questions, and how to respond if you get a task like this. And I hope you've got a clear idea about these things. We'll meet again in the next live. Until then, bye, good night, and take care.